So now we're going to talk about the, okay. Now we're going to talk about the wet spirometer, and you know, if you remember what the wet spirometer was, it was that little blue tub that you breathe into it and the little white little tub thing kind of moved up. And it kind of just measured how much air you're breathing in and out. And you just need to know a couple things. Is you have these terms right here. So tidal volume, what tidal volume is that it tells you how much you are breathing in and out normally. So you're just breathing in normally and breathing out normally, and what volume that is. And it's and you have to know the amounts for every single one. So remember to look in your lab exams and know the specific average amounts for each type. You have your inspiratory reserve volume, and so that's when you breathe in and out normally, and then you breathe in even more as much as you can. That would be your inspiratory reserve volume. Your expiratory reserve volume is when you breathe in and you breathe out normally, and then you breathe out even more, and that would be your expiratory reserve volume. Now your vital capacity, what's your vital capacity? The formula is inspiratory reserve volume plus tidal volume. Did I say times? No, don't do it. It is inspiratory reserve volume plus tidal volume plus expiratory reserve volume. And that will be your vital capacity. It's going to be the minute respiratory volume, which is equal to tidal volume times your respiratory rate. So that would be in how many breaths per minute. So you might have to do like some minimal calculations. It shouldn't be too hard. Woo! Okay, yes. So it's minute minute respiratory volume equals tidal volume times respiratory rate. So another thing that you need to know is regarding breathing through a straw. So if you imagine with me, this is not a straw, but if you imagine with me, this is a straw. So I'm breathing through this straw. And so I'm breathing through the straw. And what's happening is as I'm breathing through the straw, my breaths start to decrease, meaning that my respiratory rate, you can see here, I wrote it down, my respiratory rate decreased. It's because I'm taking slower, deeper breaths. And so I'm taking deeper breaths, that means that my respiratory rate is decreasing, so I'm breathing less per minute, and that is because of the anatomical dead space, because you're adding more area in which you have to breathe through. So then you're increasing, pretty much you're increasing from what you have here into the straw. So you're increasing, it's becoming longer from the opening of where air goes in to the lungs. The anatomical dead space is pretty much the area where there is no transfer of oxygen and carbon dioxide. So the anatomical dead space would increase because this area is anatomical dead space. There's anatomical dead space that goes to the trachea and a little bit to the bronchi, but when it goes into the bronchioles and to the alveoli, that's where there's transfer of oxygen and carbon dioxide. So since the anatomical dead space increases, that means that you have to take deeper, slower breaths, and your respiratory rate has to decrease as well. You would notice that we went over 3 different types of breathing measurements, and these breathing measurements were done when you hyperventilated, you rebreathed, or you exercised. So during hyperventilation, so hyperventilation is when you're breathing in and out very fast and as much as you can in and out, and that's when you're like like a dog. So when you're breathing out like very quickly in and out like a dog, you would notice that afterwards you would notice that your respiratory rate would decrease, and your respiratory rate would decrease because your oxygen levels have been already replenished inside your body, so then you don't need to breathe in as much as you need to because the body has the right amount that it needs to survive. Additionally, you would also find that your pulse would also decrease because your cells don't need to be replenished right away. So blood doesn't have to travel down your body as fast as before. Also, you can hold your breath longer because you have that reserve oxygen in your body, so then it can handle the lack of replenishing for a little bit longer than normal. The next thing that you did was rebreathing, and in rebreathing, what you did is that you breathe into a paper bag, and when you breathe into a paper bag, you're breathing in the carbon dioxide that you're breathing out. So you're breathing out the carbon dioxide and you're breathing it back in, and as a result, the percentage and the amount of oxygen inside the bag decreases more and more. And as a result, your body finally realizes, oh, we're running out of oxygen. So what happens is that it tries to make you breathe more. So when you want to breathe more, your respiratory rate would increase. Additionally, your pulse rate will also increase because it's trying to transfer as much oxygen energy as possible to the cells. And also, of course, which makes sense, is that you can't hold your breath longer because you're losing your oxygen energy and you're trying to replenish it. And when you're exercising, this is probably the most obvious one, is when you're exercising, your respiratory rate increases. And that's because when you're exercising, you're using up your energy, you're using the ATP, and as a result, you have to increase your respiratory rate in order to have more oxygen in your body. And also your pulse rate would increase as well because you're trying to pump that blood throughout the body with the oxygenated blood. And also you can't hold your breath as long as well because similarly to rebreathing, your reserved O2 levels is very low. So one last thing that you needed to know was regarding the bell jar. So this right here is the bell jar, and these all represent different things. So this little blue thing right here, it would represent the trachea. This over here, this little clear cavity right here, would represent your thoracic cavity, while the pink balloons represent your lungs. Now this little flap things right here, which allows the lungs to inflate and deflate, would be your diaphragm. So what would happen is that when your diaphragm contracts, so when contraction occurs, that means that you're pulling on the lungs and it goes down. So when you're pulling on it and the diaphragm goes down, what happens is that the pressure inside the lungs decreases. And when the pressure inside decreases, the volume increases. So that's what Boyles Law is, because this thing tests Boyles Law, is that when pressure increases, volume decreases. When pressure decreases, volume increases. So they're opposite. They're inversely correlated. So when the diaphragm is contracting, when it's pulled down, the pressure decreases and the volume increases. So when you push in like this, so when your diaphragm relaxes, what happens in your lungs is that the pressure in the lungs increases and the volume decreases. So what happens, so for example, if you get stabbed, stabbed in the thoracic area, so please no violence of any kind, but for example, if you got stabbed. So this is a representation of you getting stabbed. And then there's this, now there's a hole in your thoracic cavity. Now what happens is that now your diaphragm can't do anything. There can't be any pressure change inside. It's now an open jar, not a closed jar. So as a result of you can't change the pressure inside anymore, you can't increase or decrease the lung volume and pressure. So that's what that happens. So that is testing Boyles Law through bell jar.